Hi rehabbers, I got a pain in my neck and I just can't get rid of it. So this is true in many cases. Some of you might have. When you swallow, something's stuck in your throat every time. Every time you turn to one side, it just creates a searing, shooting pain. Sometimes when you do a chin tuck for an exercise, it also creates pain. And sometimes it just flares you up. You just might have a limb defect. And we'll show you how we take care of it here at Rehab and Revive.
So what happened?
Dr. J, I messed myself up.
Doing what?
I was like weightlifting and I have like no neck range right now and I've got nerve tension. Like this side is pretty good. We're doing good.
Yeah. How far can you lift this side?
I think right here I could go past it, but I'm like gonna cheat.
Yeah.
Cheat, so
how far can you turn your head?
So we're doing here.
Any problems with that? But that's pretty stiff.
Tight. It feels tight. It just feels tight. Having a tough time swallowing, a little bit of breathing, but I just feel like a frog in my throat.
You have a frog in your throat.
And then I feel like I've run into something here, and then like it's blocked. Yeah.
Right there. Well,
and then I know it gets shorter here because I've been messing around with my nerves. It won't help.
Dr. Lin hurting himself lifting weights, trying to be buff.
Yeah, gotta cut down in 2017. Less calories or burn more calories. Very different, right? Yeah. So I think I have a limb defect.
A limb defect.
We're gonna talk about that a little later if you're interested what that is, but
pretty interesting.
Yeah, pretty interesting. So we created a technique here. Dr. J's gonna perform it on me, and we're gonna go after it and see if we make changes.
All right, let's go.
Let's do it. So I think most of it's prepped to go, but Dr. J's gonna help here, and she's gonna check it out, make sure that's what it is. It's not just a rotated cervical spine or neck bone.
Not all patients are this aware, by the way.
Super aware. I have the most sensitive everything.
Hold this here.
Hold it?
Yeah.
Yeah. Good. I can feel the needle the moment it pierces my vein when they draw blood. I thought that was normal for a long time.
What?
You didn't know that? I could feel it enter the skin and pierce, and then the moment the heat of the blood rushes out, I could feel that very millisecond.
You gotta be kidding me.
I thought that's why I didn't like going to doctors when I was younger.
You have a special talent. Okay, yeah, this is lower than normal for you.
Yeah, this is. So I usually have a C4-5 limb defect, but it's been good for the last like month. So.
Yeah, this is harder.
And what it is we believe is ligaments that have been torn either by trauma, repetitive use, or. So we've developed here at Rehab and Revive something a little different to try to get it over, but I know. I'll stop talking.
There.
Yep.
Okay.
So we can go on the facade. Okay, we're good.
Sorry.
That was good.
Alright, so hold.
Okay.
And so look to the left. Open your eyes.
Yeah. It doesn't feel great.
It doesn't feel the greatest. There. Open your eyes. Making sure it doesn't pass out. Okay, good. Come back.
Let's try the TPs. They might help.
Yeah.
Yeah. And this one's gonna be the stubborn.
I know. I was gonna say. I was like.
It's been out for about 2 weeks.
2 weeks?
Yeah. And it threw out my ribs. So I was like, this is no good. No good. I messed up. Help me.
It actually helped a little bit.
Yeah. So we'll do this. Oh yeah, I feel that in my rib. Holy smokes.
Dude, you're pushing against yourself, right?
Yeah.
Okay.
I'm just trying to get past that. I felt that in my rib.
Yeah.
Okay, good.
There.
Oh man.
There. Go back.
Yep.
You check it.
I felt that all the way in here. Like an intercostal nerve, if you guys want to know what that felt like. Well, you don't know what that feels like. Some of you might.
No, I don't.
That did not feel good. But it shifted in place.
Okay.
And my voice got deeper.
Yeah.
I grew up. I mean, I grew up. I grew up. I hit puberty.
No, that feels better.
Oh yeah.
Yeah.
Now let's re-educate it.
Oh.
I hit puberty. Thank you, Dr. J. So, miracles.
Oh my gosh. You're really gonna put this Good slowly.
Oh, that's right there. That's about it.
Yeah.
So we're re-educating. Why are we re-educating, Dr. J?
Because you don't want it to slip back out. And teaching it its new range, new muscle supply, and this new range that he just got right now.
So we want the stabilizing muscles to...
Yeah.
Wow, my voice is so much deeper.
Yeah, your voice got deeper right when it went back.
Well, thank you so much.
Yeah, I don't want my voice to get deeper.
Let's see. And then I figured we could try to re-ed like the scapula or the shoulder blade. So there's some precautions to this technique. Don't do this at home. Make sure you come only. We're the only place that does this actually. So we have
called the Lynn Defect.
The Lynn Defect, Dr. Lynn Defect. I have like 3.
I have 5.
She's got 5. And a lot of times it happens because we like to pop ourselves, or we did like to pop our necks. Not a good thing. And I think that's how the ligaments tore or sprained or... There it is. Good. And we're just doing some re-education so my brain integrates this new position. Sound about right?
Yes.
Am I making sense?
Yeah.
Good. Oh, that's awesome. I think we got it.
Let's check him out.
All right, let's get up.
He hit puberty.
Yeah. I don't know. Can you guys tell that? Yeah. I can turn this way. I can't turn that way.
Yeah. Let's
I'm allowed to turn this way, but once this is in, you're not allowed to turn. And then we'll explain that a little later.
Oh yeah, that's a lot better.
Oh, yeah.
That's a lot better. Let's see
Let's
this
see my arm. Jello.
Nice.
Mellow Jello.
Oh,
My goofier side today.
Right now.
I think it was cutting like my circulation in my brain, so I might be. I'm not gonna look at you because I'm gonna throw it off. So stay tuned if you want any more. Thank you, Dr. J, for letting me grow and hit my growth spurt today. So we'll be back. So what you saw was very real. I couldn't move to the left. My arm was there. I was getting pinching. I was getting other domino effect issues or compensatory issues that were running down my rib cage. So I had Dr. Hoko help me out, and you even saw voice changes. I really could feel it. I still have it a week later after shooting that video. But I think you might want to know what just happened here. So I think the best way to describe it is there's these bones, these facets from the segment above that went over the bottom segment, which is supposed to stay in front. Now it went from the back to the front and it can't go back. And so that's why a lot of times when you're swallowing, your throat is bumping into these facets, and they're making like a boulder-like or a rock, a sharp pain. Also, you can imagine every time you turn, if you turn here, you're pinching these nerves. And not just that, you might feel coldness. So those people with those thoracic outlet syndromes, maybe this is what's going on. So you might have to rethink what's going on every time you do a chin tuck and you're feeling that block. They're supposed to move behind, not in front. Every time they move in front and you're trying to create a motion, yeah, you can get some compensatory or actions there, but you're pinching that poor nerve and you're creating those symptoms down the arms. And the results are great after what we're doing with these neuromechanical therapy techniques that we've created here at Rehab and Revive. So this is, yeah, no one's doing it right now. And that's why I called it the Lynn Defect. I don't want to, pat myself on the back, but I went on the computer and I researched everything as much as possible, and no one's talking about it. Now, what I think is really going on possibly and why people can't find it is that the cervical spine, this part, I actually believe there's some ability to rotate, and so, or not rotate, or twist. So when this part goes to the front, it actually twists and then creates a ancillary bend. So when it should be normally this way, the world thinks in this plane. It's just like when the world thinks it's you know, the universe or the earth was square. We actually believe there's ability to twist, because it's true. This is a giant ring for those of the professionals that are watching this right now. So, but you know, why is this happening? I believe a lot of times practitioners who do a lot of manual therapy or manipulations are blowing past these barriers and ripping the ligaments, and it sounds really disgusting, and it probably is. It's really severe. And then they're just cracking that and putting it over, or those that like to pop themselves. That's another thing, big thing in their history. Or repetitive use of being on one side is generally the population that I see this on. And then they usually have symptom-wise, they can't raise their arm, they can't turn their head about 50 degrees, no history of other traumas. Whiplash also can happen as well. So we want to put these back as soon as possible, and results are great. Usually takes 2 or 3 visits, but you can see that, you know, these nerves connected to this poor arm, you zap this poor guy, and then it sends these signals down to your hand. And like I said, with this model here, you can see how closely those blood vessels run right alongside. And so, you know, you swallow, you know, it's gonna pinch, all these little things. So that's the limb defect. It's very interesting. I think, you know, we had to go and create something because patients needed it. They weren't getting better. I did everything I possibly could, and now developed a technique that really works. And you saw it with Dr. Halhoko. So give us a shot if you're not getting better anywhere else. But if you like what we're doing, and I always keep trying to innovate and push the industry, please subscribe below and keep sharing these videos. Leave a comment. I know I'm a little bit of a rogue cowboy and this is not going to make people happy, but research isn't, you know, around because this is so new, and you know, we have to wait till technology catches up so we can actually see these things happen. But I think this is something in my later years I'm gonna have to research. So I'm Dr. Lin. Remember, we can and we will get better together. So another way to think about this, although it's not a laughing matter because it actually really happened. A golf friend of mine was talking about his brother who loves to take four-wheelers out in the sand dunes. What he did one day was go over a giant sand dune, and he didn't realize what was on the other end was a paved parking lot. So he broke everything, and that was as violent as it sounds and as freaky as it sounds. That's kind of what's happening to this poor joint. It went over the sand dune, and right smack down there is a parking lot or a highway, and the result isn't very good. And this is why you're feeling what you're feeling.